give your feedback in the form of text messages on this very number. Vertigo or the balance is a learning reflex. With advancement of age from first day of life onwards, we keep on improving our balance and posture. It's a learning reflex. Even animals can be trained. If you are going on recreation to various islands, especially in the Asia, you will see many elephants are being trained so nicely that they can do enormously very good balanced activities. Physiology of the balance is very simple. It's our vestibular system that is specially designed, very specially designed to keep our balance system absolutely fine, very graceful when impulses are passed from vestibular system to the brain stem and cerebellum. This is a CNS part, central nervous system part, that controls our balance. There are 4 nuclei at the junction of pons and medulla that receives impulses from vestibular system that controls almost the whole of the body's fine, fantastic, dynamic balance. Impulses are also coming from our body, from pressure, position, and proprioceptive sensations. These sensations apprise, acknowledge the brain about our posture, about our position of various parts of the body, and the balance. And through spinal cord, impulses are passed very slowly from position, pressure, posture, and proprioceptive sensations from various tendons and joints. VN also contributes to some extent for the fine, very fine balance. The VN also helps a lot. But 90% plus fine impulses are passed from both the vestibular systems towards the brain stem that controls our fine balance. And maintenance of fine balance is also called equilibrium. And there are 2 parts in the vestibular system that controls our balance. Utricle, this controls static balance, resting balance. Right now, we all are sitting, enjoying at our home or in offices, in sitting posture, in lying down posture, in absolute resting posture. Utricle is a part of internal ear that controls our balance while in rest, while in sleep, while in the good times when you're not moving a lot. Semicircular canals are for dynamic balance, for active balance, for when you're running very fast, when you're doing various activities in the oval ground, or you're looking at things are being in various circus-like movements, Olympic-like movements. In Olympics, people perform very high, fine, coordinated movements, even monkey-like movements, cheetah-like movements. All these movements are nicely controlled by semicircular canals. There are 3 semicircular canals that are nicely configured, formed at 3D dimensions, right angle to each other. And from here, impulses from semicircular canals are passed exactly to the nuclei at the junction of pons and medulla. There are 4 nuclei at this junction on ipsilateral side and the same number on contralateral side. So resting balance is controlled by utricle, and dynamic balance, active balance, very fine movements are controlled by semicircular canals. From semicircular canals, impulses are passed exactly towards these 4 nuclei on each side and then flocculonodular lobe. Flocculonodular lobe is the anterior-most part of the cerebellum that touches the medulla oblongata. So semicircular canals in connection with vestibular nuclei and flocculonodular lobe of the cerebellum controls very active, very graceful movements, very sharp movements of the body. So, in small summary, we can say the resting balance or static balance is controlled by the utricle, the inner part of the internal ear, and from here impulses are again passed to the same four nuclei and to the various nuclei inside the cerebellum, but not the flocculonodular lobe. Flocculonodular lobe in connection with these nuclei and semicircular canals, three on each side, controls the dynamic balance, active balance. And this part of the brain, my dear friends, is active, effective at milliseconds level, not at seconds, at milliseconds level. Semicircular canals can sharply control our balance system. So go through this ABC, the fundamentals of balance from Guyton, that gives very nice, basic, simple principles how our vestibular system and the brain works at automated level, at subconscious level to control the balance. Now the symptom, how the patient will present to us. Patient can have very simple words like revolving of the surrounding, or the body is revolving, or there is just swaying of the body, or there is a giddiness, or there is a dizziness, or patient may say sunkenness of the heart. And patient can have any symptom, but the best way word recognized entity is subjective sense of imbalance. A patient, any person, even doctor may say that I'm not feeling fully balanced. I feel swaying of the body. There is something revolving around me. The whole earth is shaking like anything, earthquake. When everything is fully stable, but he is totally so unstable, he feels cyclone-like and tornado-like movements in surroundings. So subjective sense of imbalance is called dizziness, giddiness, vertigo. In fine, precise history, when we write down history, we will write down patient's language. We won't use medical terminology, giddiness, dizziness, vertigo. These are medical words having different meanings in different parts of the world. But most important in precise, fine history is patient's word, whatsoever he is asking for. So patient can have a real problem, 90%. Patient can have 10% psychogenic issues. Patient, everything is fine, but patient is not happy. He's having something at subconscious level in the form of various psychiatric ailments. So we have to respect patient's feeling. There are two types of vertigo or dizziness or giddiness: peripheral in origin and central in origin. Peripheral usually is taken as vestibular, and central anywhere in the brain, but mostly brainstem and cerebellum. Mostly you may be asked, we may be asked about what are the peripheral and what are the central vertigo. So there's a sharp difference between both of two. Peripheral is always very short-lived, few seconds to few minutes, usually associated with nausea and vomiting. Because it's a peripheral in origin, it is having latent period from stimulus to the appearance of its. For example, is position oriented. For example, it's a viral in a region. For example, it's a bacterial in a region. For example, it is a drug induced. So from induction to appearance, it will take some time. It's fatigable. When the stimulus is off, usually it is off. It will continue the stimulus like viral, like drugs. After some times, it will go away because the center will supersede. If the brain is okay, it can control all the peripheral odd movements. So we must remember these words. Peripheral, peripheral vertigo, peripheral dizziness is always short-lived, not more than many minutes. It's most often associated with nausea, vomiting. It is most often very severe. Patient is hardly able to walk at that time. He's so disturbed that the life is totally, he says, ruined. He's so upset. Patient may or may not have association with deafness or tinnitus, ringing in the ear. So symptoms are mostly confined to the ear. Other symptoms of the body are almost absent. When many symptoms of CNS are there, weakness of one side, dysarthria, speech problem, dysarthria, pass pointing, repeated movement cannot be controlled, dysdiadochokinesia, then it's always central. So central vertigo, my dear colleagues, is mild to moderate. It's a long-standing. It's not having latent period. It's not fatigable. It's with the usually associated neurological deficits like CVA, one side weakness of the body, or cerebellar symptoms like pass pointing, there's a tremor, there is the speech is disturbed, patient is not able to speak very clear, profound sound words. So it's a cerebellum. All the cerebellar symptoms may not be associated in the central. So if it is associated with cerebellar symptoms, few of them are neurological deficit, it is certainly central. Mostly you will see a word CVA, cerebrovascular accidents, hemorrhage, clot, formation, or some infective process in vicinity of the brain. Infection can lead to CNS symptoms. So peripheral vertigo and central vertigo are two different entities. We should be sharply clear about it. Common causes of dizziness, we should know a lot about. Vestibular symptoms, vestibular causes are 80 to 90%. Most of the vertigo, most common vertigo is vestibular in origin, is a sphere, it's a peripheral. And among peripheral and the vestibular, most common one is benign paroxysmal positional vertigo. If we have to remember one entity throughout the causes, that is benign paroxysmal positional vertigo. It is so common that all patients coming to clinics, general hospital or teaching hospital with the physician, with the pediatrician or anywhere, 80% are all from benign paroxysmal positional vertigo. The second common cause, vestibular neuritis or vestibular neuronitis, and it could be Meniere's disease. It could be cervical spine issues because of with age, there is cervical spondylitis or bamboo neck. It can cervical trauma, whiplash injuries, sudden movement of the head in a violent phase is called whiplash injury that can lead to very severe vertigo for many weeks. Central cerebellar issues, infective, cardiovascular, clot formation, or infarct inside this area, brainstem or cerebellum, can lead. Among metabolic, the most common in our part of the world is diabetes. Diabetes is enormously common in all age groups, especially after 35 to 45 years of age. Every patient having any symptom, diabetes should be ruled out. Same is in common anemia is another common entity among drugs, aminoglycosides, chloroquines, or antimalarial drugs, antimitotic drugs, diuretics, especially Lasix, furosemide, is a common cause of vertigo or vestibular damage. These two drugs should not be combined because both are vestibular toxic. The toxicity will highly amplify. So aminoglycosides in the form of amikamycin, gentamicin, tobramycin, penicillin should be given very selectively and never should be combined with Lasix or furosemide. It leads to high index of toxicity. Psychogenic could be 10 to 20% people who are having no issues, but they are misfit, they are not happy at home, there's misfit marriages, unstable situation at home, stepmother, and both spouses are not mixed with each other. There could be multiple causes underlying this psychogenic psychiatric issues. The last but not the least is somebody during motion, during movement in bus or car or moving upstairs, moving in mountain areas, can have always dizziness. During these very movement activities, a patient is always having nausea, vomiting, it's better to move, to travel, empty stomach. Take very little diet before such movements, before such traveling. And if at all one has to do and the patient is having real motion sickness because it's one of the very common entity known, so we must know Stemtil or prochlorperazine or cynarizine, one tablet before traveling, before such movement in a car or bus or anywhere, especially if you're going to mountainous areas through salt trains or muddy, you should take very extra care because the one passenger can spoil the enjoyment of others. So it's very known fact about motion sickness. So I'm talking about vestibular, that's a peripheral vertigo. The most common one is benign paroxysmal positional vertigo. Patient always say that in a particular position, moving towards right, especially early in the morning, there's a cyclone-like, tornado-like, very severe vertigo. Patient is having violent nausea, vomiting, and once he attains the same position, he shifts the head on that right or left. Always patient is having the same movement. And most often this entity is self-limiting. Is 99% known fact and we know a lot about it and we can control in almost 100% patients. Dizziness, clinical symptoms and signs. Patient is having imbalance, sunken heart, hardly able to walk in a particular one position or in all positions. A patient is having very severe vertigo in all positions, hardly able to raise the head. It is severe, most often very early in the morning. And vomiting is so severe that hardly he is able to have a sip of water. It is mostly a cause known as vestibular neuritis. Vestibular neuritis. It's viral in origin. Among various tests and how we assess precise history, clinical examination, and in clinical examination, we'll check the gait. The patient is having very fine gait, a passing straight. Certainly it is nystagmus very little. If the patient's nystagmus is very severe, even with little movement or without, it's first degree, second degree, and third degree, according to severity. One test that's known from first year of MBBS, Dix-Hallpike maneuver. Dix-Hallpike test, also called positional testing. Patient is placed supine and the head is in hanging position, 30-degree off, on right, left, and central position. This test is very, very useful. We should do it in clinical examination. We can show you the picture, but this test is having high degree of accuracy in determining peripheral or central vertigo. If it's only in one or two positions, certainly it is a peripheral. Caloric test, that is a very fine test to check the integrity of the internal ear. CNS test, certainly gait, if it's in the form of drunken gait, broad base gait, patient's tremor is extremely there. If you are asked to pick the point and it is more intensified, that is called pass pointing, tremors, speech is totally splitted. Patient is not able to complete the words like its patient can see the words, but there are a lot of stoppage in saying just few words even. And dysdiadochokinesia, them very cerebellar signs, almost all are present if there is cerebellar pathology. Here one body who is doing this tandem test is how repeated supine and prone positions. Investigation will be very simple to a fine one, like hematological tests, blood tests, lipid profile, more is the disturbance in lipid profile, more is the chance of CVA. So weight should be controlled, patient posture should be maintained in a nice way, and X-ray of the spine to see intervertebral discs, to just rule out bamboo neck, or if there is intervertebral disc, vertebral bodies may be damaged, or the flexity of the neck is lost, and intervertebral space is decreased. That is very important in X-ray simple spine, X-ray simple cervical spine. CT scan most often can rule out many of the pathologies of the CNS, especially the spine. MRI is very good investigation for brain if there is CVA-like situation or there is aging process, there is atrophic changes in the brain. Very rarely positron emission tomography is being used. If pathology is too little, it's available in the town. How we treat these patients. Now we're giving overview. We may go through one or two very common situations alone, but the most common treatment, usual treatment is control the cause. If we know it is viral in origin, it will go away with time because the most often underlying pathology is diabetes mellitus. Patient needs rest, patient needs good posture, patient may fall, so we should have to take care of. If spine is unstable, then neck strengthening exercises with or without help of physiotherapists. Physiotherapists are doing very good job in keeping our positions absolutely normal, physiological and strong one. And guided neck exercises will not only alleviate, vanish these problems, also strengthen our neck muscles. Neck collars, hard collars, soft collars, both are available. If nothing works, age is already advanced, more than 65, 70, nothing works, we seriously think about soft and hard collars. Medication, we should know many words, especially simple words are best bed rest. Patient should move very slowly. Support system should be round the clock. He or she will be accompanied by somebody whosoever is having dizziness or giddiness. He or she should move slowly, avoid driving for at least 2 weeks until the last mild symptom of imbalance has gone. A good posture, if you just take deep breath and hold, deep breath and hold, and shoulder little back. Always keep this position on and on. So tidal volume and vital capacity, there's a big difference. Try to always to take deep breath and hold for a while. And now relax your body. This is the best position ever you can do. And it should be your continuous habit to walk, to sit like that, even during sleeping. Try to have deep breath so that it's your habit. Cervical collars may be required if nothing works in elderly patients. This is the maneuver that everybody will read it out. Benign paroxysmal positional vertigo, treatment by and large if simple drugs doesn't work, Epley's maneuver within no time in 80 to 90% individuals, 80 to 90% all patients who are having benign paroxysmal positional vertigo, the most common vertigo, can be controlled with Epley's maneuver. It is exactly 360-degree movement of the body in opposite direction from where the calcium carbonate crystals, which are the real cause, underlying cause in benign paroxysmal positional vertigo. Epley's maneuver we read out, we repeat it. This maneuver we should know a lot. Among medications, the most common medicine being written is beta-histine. Beta-histine tablet is available in 8 milligram, 16 milligram, and 25 milligram. Group will ask for few weeks. Usually it solves problem within no time. Sometimes ginkgo biloba extract, it's available enormously. It's one of the very useful drug, but we depend mainly on beta-histine. And if things are too severe, then we'll always add Stemtil or prochlorperazine. This wonderful drug, very ancient drug, old drug, but it works very well. Cynarizine in the form of Stugiran, that works very well. Prochlorperazine and cynarizine are the wonderful drugs. These leads to labyrinthine sedatives, very active abnormal focus inside the internal ear are certainly sedated and physiology is normalized with the help of this drug. Is also very useful for motion sickness. If there's a motion sickness, one tablet just 30 minutes before traveling, empty stomach or few sips of something lemonade will work very well, and there won't be serious vomiting or nausea a patient has taken well in time. So beta-histine and prochlorperazine, it's especially dosage, we should know a lot, and this can control 98% individuals even without maneuver. And secondly, we must know benign paroxysmal positional vertigo and Epley's maneuver. Epley's maneuver. On YouTube, this maneuver is nicely being portrayed, how we do it, so that we can control it very nicely. So I'll recap the whole story, how we can start, but most often we depend on beta-histine. We depend on beta-histine, that's form of SERC, beta-SERC, and various names, but beta-histine, this is actually histamine analog. It works more or less like histamine. It's effective even on H3 receptors, histaminic receptors, and further receptors inside the internal ear that violates the whole physiology. it blocks that area even. It's a beta histine. It's a very good drug. 8 milligram, 16 milligram, 24 milligram, according to the severity, for 2 to 3 weeks works very well. And for motion sickness, or if things are not being controlled by beta histine, labyrinthine sedatives, prochlorperazine is very useful. Cynarizine is uncommonly being given by cynarizine in 25 milligram and 75 milligram. Both are available. It's very useful for tinnitus, for abnormal ringing, something coming from the sound of brain. It controls very well. So we'll recap the whole story of dizziness, giddiness within no time because we have few minutes. So have a very good time with your family. Enjoy it nicely, but make a timetable so that you can cover your syllabus curriculum with time. If you have any query, any feedback, if you are not listening us, because with this much internet facilities, sometimes things go away. Maybe you're not listening us very well. Maybe somebody's not attentive. So we should be sharply in touch with each other. If you're having any problem, just have a text message. We will respect your feelings and will like to solve your issues. Equilibrium or the balance control is a learning reflex. From day one, the baby learns. After few days, he starts moving. And after few months, he starts sitting. After 1 or 2 years of life, the baby starts walking in a gentle way, like a gentleman, and the family is happy. Like us, animals also learn. And if they're trained, they can perform very extraordinary movements. How we control our balance. Slow impulses are coming in the form of position, posture, very joint movements from all over the body through spinal cord in a slow way towards the brain stem and cerebellum. Very sharp milliseconds, many thousand per minute are coming when we are sharply moving from vestibular apparatus continuously from right to the left that appreciates our brain, appraise our brain, acknowledges our brain. We are balanced or we are imbalanced. VN sharp balance, when you're moving too sharp and something abruptly coming in our way, VN helps a lot. In 10 to 20%, very fine movements, VN also contributes to network from the eyes towards the brain stem and cerebellum, also helps for the fine control of balance. Among balance, there are two types of balance. One, impulses are passed when we are at rest. Right now we are sitting, enjoying while sitting and moving very little, or sleeping, lying down. Impulses are passing slowly from utricle towards the brain stem and towards the cerebellum.
Sir, sorry to interrupt you, just 2 minutes left, sir.
In sharp movements, okay. In sharp movements, in very dynamic movements, semicirculars performs a very key role through brainstem and flocculonodular lobe. So, subjective sense of imbalance is called vertigo. We should know a lot about peripheral vertigo and central vertigo. It will be asked in SCQs and MCQs. Common causes are mostly peripheral. Among peripheral, benign paroxysmal positional vertigo and vestibular neuronitis is very common, followed by Meniere's disease. Cervical spine issues, the bamboo neck, cervical spondylitis are another common causes. Diabetes mellitus, anemia, various drugs, psychogenic issues are other causes. Motion sickness, we should know a lot about motion sickness. This can be totally vanished with small care. And prochlorperazine. These are the fine tests that we can do to make difference between peripheral and central vertigo. Investigations can be performed audiological and radiological. We can have treatment very simple like bed rest, move slowly, have a support system, have a
So lecture time is
company.
over. Sorry.
Just 30 seconds.
Okay, sir.
Vasodilators will help a lot, especially beta histine. Sometimes labyrinthine sedatives will be added. Motion sickness can be controlled nicely by prochlorperazine. Thank you very much. Have a very good time. If you have any problem, your feedback will be appreciated. Thank you very much.